The ideas expressed in City Club forums are those of the speakers and not of the City Club of Cleveland, IdeaStream Public Media, or their sponsors. Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.
Good afternoon, and welcome to the City Club of Cleveland, where we are devoted to conversations of consequence that help democracy thrive. It's Friday, August 8th. I am Stathis Antoniadis, President for University Hospitals Cleveland Medical Center, and I'm honored to introduce today's forum, which is presented in partnership with the Junaid Family Foundation. Since its launch in 2020, the Gates Foundation has remained committed to fighting the greatest inequities in the world. For 25 years, the organization continues to be a significant leader and influential force in addressing global development issues, which include health, livelihood, and education. Today, it is a privilege to hear directly from Dr. Anita Zaidi, the president of the Gender Equality Division of the Gates Foundation, where she oversees efforts to advance gender equality by including gender in all of the foundation's global work. Now, Dr. Zaidi will likely be the first to tell you that there is no simple solution or singular approach to gender equality. When communities prioritize women's and girls' health and well-being, and empower women to be leaders in their society, everyone benefits. Dr. Zaidi is also a pediatrician and infectious disease specialist. Previously, she was the department chair of pediatrics and child health at the Aga Khan University in Karachi, Pakistan, where she worked to reduce child mortality. She joined the foundation in 2014 to lead a team focused on vaccine development for people in the poorest parts of the world. In our conversation today, we will learn more about recent efforts by the Gates Foundation to improve gender equality and what it takes to truly invest in women and children. Moderating this conversation is my colleague, Selena Kananan, Chief Health Impact Officer at University Hospitals. Selena is an experienced clinician leader and for 15 years served as UH's inaugural division director for nurse midwifery. Under her leadership, UH Midwifery grew to be the largest network of midwives in Ohio. She also serves on the board, First Year Cleveland, our region's civic and community collaborative to address infant mortality, and chairs the Ohio Commission on Minority Health. A reminder for our live stream and radio audience, if you have a question during the Q&A portion of the forum, you can text it to 330-541-5794, and the City Club staff will try to work it into the program. Now, members and friends of the City Club of Cleveland, please join me in welcoming Dr. Anita Zaidi and Selena Kananan.
Thank you, Stathis, for that warm welcome. And Anita, it's such a pleasure to have you here in Cleveland to visit us and to talk more about the work of the Gates Foundation. And the Gates Foundation has been in the headlines this week. And I know many of us have a general sense of the work, but I wonder if you, for those of us who might not know the full picture, could you walk us through what the foundation does globally and more personally, what your team in the Gender Equality Division is doing to support women and girls around the world?
Sure, Selena. So I have to start by thanking the City Club of Cleveland for the wonderful invitation and hospitality. It's such an honor to speak here. I mean, this club has a storied history, and I'm just grateful also for the book that Dan gave me this morning, and I'm going to treasure it. So incredible honor to be here, and thank you also to the Junaid Family Foundation for sponsoring the event. There's such a sense of community and giving in Cleveland that I am just overwhelmed by, is what I would say. So the Gates Foundation is now 25 years old. It was established by Bill and Melinda Gates in 2000. And the foundation has a very simple but profound mission. It's everyone deserves an equal chance, an equal opportunity to lead a healthy and productive life. We've chosen to focus on 3 areas. We focus on closing the achievement gap in education, on economic mobility, and on health. In the US, our work is mainly focused on education and economic mobility. And globally, we are most known for our work on health. And within that, maternal and child health, reducing and preventing infectious diseases, such as like killer infectious diseases like malaria, TB, HIV, polio, and then in lifting millions of people out of poverty through our work in agriculture or financial services or poverty alleviation. In my division, which is now 5 years old, I have the incredible privilege of working for women and girls around the world. And what we focus on, again, it's very simple, but it's very powerful. What we're trying to do is improving women's health, incomes, and power to shape their own lives. Okay, and too many women and girls around the world do not have that. They do not have the power or any income generating ability or even the choice on their own to shape their own destiny. 12 million girls around the world get married before the age of 18, like what we call early and forced child marriage. So how do we make the world better for women and girls? And the fundamental belief there is that by making the world a better place for women and girls, we make the world a better place for everyone.
Such an important message. You were just in Boston with Bill Gates and had some big news to share. For those that might not be familiar with it, tell us a little bit more about what is that big news and why now and what does it really mean?
So what Selena is referring to here is a very big announcement from the Gates Foundation and from my division on an increased focus on women's health R&D or women's health innovation. And the reason for this is that when we were establishing the gender equality division, one area that we saw where the foundation could play a catalytic role was in really changing the paradigm for women's health. And I'm a pediatrician scientist by background, and when I practiced in Boston, in North Carolina, and in Pakistan. So all across, when I looked at what was happening to children, it was so intimately connected to what was happening with their mom and their family, right? If the mom and the family were doing well, the children were doing well. For 5 years, I took care of children with HIV. Right? And this was at a time when there was no highly active antiretroviral therapy. So this is 1995. HAART came in late 1995. So when you were taking care of a child, you were really taking care of their whole family because their mom also had HIV. Typically, the dad wasn't there. And social workers and all of that support was so important. And if the mother was alive and the grandmother was alive, the child did okay. But if they weren't, the child died. And so it really crystallized for me that this is all connected up. Yeah. So when the opportunity to start the division was there, I made a very big case for we really need to do more for women's health broadly. And we also wanted to make this not about the Gates Foundation and what we thought. Okay, we wanted this to be a community-led effort. So we actually set up structures that talk to a lot of women from around the world about what was important to them. A lot of researchers, ethicists, regulators, biotech, academic, people who have spent their life working on women's health, midwives. They're like, what is it that's important that is lacking right now in women's health and what should we focus on? And the result of that was actually, we held a very big forum, a forum like this called Innovation Equity Forum, which resulted in an opportunity map for what are the areas in which much more research is needed in women's health. And so this announcement in Boston was about a $2.5 billion commitment over the next 5 years to work in very neglected areas of women's health around the world. The work is mainly focused on low and middle income countries, but actually is going to lift up women's health all over the world. And that's our hope, is that it's a spark to the field to bring in much more new thinking and new money into neglected areas. Right now, I mean,
Thank you.
I want to give you two stark statistics, okay? If you leave out cancer, only 1% of the current R&D funding is dedicated to conditions that are only suffered by women, okay? And women are half the population, I don't have to tell you that. The second one is 90% of the drugs that are in use today have never been tested in pregnant women. So if you develop a problem during pregnancy, whether that's connected to your pregnancy or not, there is no, we have no idea of what will work or not work. Okay. Yeah. So that's where we are today. And we think that we need to change that, and we can change it.
Tell me some good news that's coming out of women's health.
All right. So thank you. Thank you for asking me that, because it can sound like a doom and gloom. But what I can tell you is, just when people put their minds to something, amazing progress is possible. Junaid and Sophia talked about one thing, which is the what we call in medical terms multiple micronutrients, but what you might hear more commonly is prenatal vitamins. So why prenatal vitamins? And actually prenatal vitamins for a whole course in developing countries costs only $2.50, less than the price of a cup of coffee.
For the whole pregnancy.
For the whole pregnancy.
Yeah.
$2.50 for the whole pregnancy, less than a cup of coffee. And what does it do? It has an incredible impact on reducing stillbirths, on reducing low birth weight babies, on reducing premature births, because poor people do not have access to a nutritious diet. Okay? This is also true in the United States. Poor people do not have access to a nutritious diet. So just the simple, humble prenatal vitamin can solve many of these micronutrient deficiencies. And now, through work of Junaid Foundation, UNICEF, many other philanthropists and governments, every woman in developing countries will have access to prenatal vitamins. Okay?
That's amazing.
Another one which I think fewer people would know about is the progress in HPV vaccines, or human papillomavirus vaccines. So human papillomavirus is the only cause of cervical cancer. Okay? And we've had a vaccine for a while, but that vaccine had very low uptake because it's either 2 or 3 doses. The Gates Foundation funded research because we were seeing a lot of data from around the world of girls get this vaccine between the ages of 9 to 11 who never came back for their 2nd or 3rd shots. And those girls were followed for many years, and none of them developed high-risk HPV disease. So the idea was, maybe you don't need 2 or 3 doses, maybe you only need 1 dose. So we funded a lot of the work around the world to show, is 1 dose enough? And the results were incredible. Like, no breakthrough disease with 1 dose of HPV vaccine. So when these data came out, many countries around the world changed their guidance, and Gavi is an organization that funds vaccines for poor countries. It's supported by the Gates Foundation. It was also previously, for many, many years, supported by the US government and many other sovereign and other donors around the world. So Gavi made it possible for girls in developing countries to get HPV vaccine. And this is a rocket that I like, okay, because the HPV vaccine uptake went from like this over 10 years to, so this year already 60 million girls have gotten HPV vaccine, okay?
Yeah.
And our target for the whole year was 80 million. So we're already 3/4 of the way there.
Wow.
And what this means is no more cervical cancer, right? Which is the biggest killer after breast cancer for women in oncology. So I think that for the young people in this room, and there are some young people, in your lifetime, you will see cervical cancer disappear. Like, it will be eliminated. Yeah, amazing story.
Yeah, that would be amazing. So you've worked with women around the world from all walks of life. For me, I've spent my entire career here at university hospitals and delivering care to women here in this community. I've caught probably over 1,000 babies in my career, which has been a privilege. It's been the privilege of a lifetime. I know at our organization we're taking steps to improve maternal health and dignity through initiatives like our Centering Pregnancy program, teen birth initiatives, our Ahuja Center for Women and Children, when we cut the ribbon on that facility, had one of the highest infant mortality rates in the nation. So we're really proud of the work that we're trying to do here in the community. But what really strikes me is how universal the experience is for women all over the world, whether it's here in Cleveland, across the country, or around the world. The fear, the hope, the need to be treated with dignity, autonomy. Why is that still not the norm for so many people in 2025?
So Selena, this is a subject I'm really passionate about. And I've thought a lot about why this is such a problem. Okay, because if you talk to women everywhere, they will say that they don't get respectful care. They don't get care with dignity, whether you're in an OB setting or you're bringing your children for vaccination, or you're at menopause or whatever your stage of life. It's a common thing that you hear. I think it's because of two reasons. One is that we have not listened to women in the R&D ecosystem, and so those issues have not been solved. And then the second is that the health systems are not designed with women's needs in mind. So if you're bringing your child for immunization, you could be walking, and I have seen this, like you could be I'll give you a story from Ethiopia where I saw a woman who had walked 20 kilometers to bring her child for vaccination and get a contraceptive for herself, and neither things were stocked, right? And what did the staff tell them is come back tomorrow, right? That is not thinking about what women are going through. So this is and why? How do we fix this, right? And I think we fix it by, and you are a midwife, and I was very happy when I saw that a midwife was doing this, and you're a midwife in leadership.
Yeah.
Yeah, which I really have to commend University Hospital for.
Thank you.
We need more women in decision-making roles in research, and we need more women in decision-making roles in health systems.
Yeah.
Okay, and that's the only way to change this.
Absolutely. What do you, you're known for combining kind of cutting-edge research with the real lives of women. Is there a breakthrough that makes you pause and think, gosh, this could change everything?
Yeah, so that's a great question, because this whole $2.5 billion over the next 5 years, what's underneath that announcement is actually 40 innovations that we think can be game-changing. And many of these can be there available for women in the next 5 years. Okay. Some will take a little bit longer, but I'll talk about the two that I think are a next 5-year thing. Okay. Or maybe three. I'll talk about three. So I think that women everywhere in the world who are pregnant and are seeking care will be able to get an AI-guided ultrasound. Okay. And what does that mean? What that means is that you no longer need a skilled provider for doing the ultrasound or interpreting the ultrasound. That this will be just blind sweeps, very small probe connected to a tablet, and I love kids. Thank you for bringing that up. It'll be a small probe connected to either a tablet or a phone that can do 3 sweeps this way and 3 sweeps this way, and you would know the state of the baby and the fetus. And what does that do in prenatal care is, especially in low resource settings, but also in settings in the United States, which are now becoming maternity deserts, right? Is this a normal pregnancy or a high-risk pregnancy? So if it's a high-risk pregnancy, the family would know that they should seek care proactively at a more higher level center.
Yeah.
So we think that this is game-changing technology, and it's coming. Like we are deep into the paradigm shifting technology right now with what you can do with AI here. The other place where AI will make a huge difference is in making sure that women get cesarean sections if they're really necessary. Okay, because now you would have because now you can have wireless fetal monitoring, which is AI enabled, which will tell you if a baby is doing well or not well during labor. Okay, So it can be a very good tool for midwives, for example, to know, and it can be a very good tool in very busy maternity centers where AI can basically be monitoring a pregnancy, and it would tell you that this is going okay and this is not going okay.
Right.
And in place, so we have two problems with cesarean sections, right? Either you get too few in places where there are not skilled providers,
right.
And there are delays in care seeking, which is most of Africa, or you get so many. For example, in Brazil, where 70% of births are now by cesarean section. And this is a whole sort of incentive structure about why this is happening, but this can be fixed by sensors that are AI enabled. The second area that's really exciting is all of the research that's happening on the microbiome that will be very helpful to women and also to men. Okay. What's happening there is, so many of our body parts are colonized by bugs. Now, these bugs can be healthy or they can be not healthy. So we are understanding what leads to a healthy microbiome and what leads to a poor microbiome. In the context of the gut, where a lot of the diseases that we think we see in high-income countries are related to an abnormal microbiome, but in poor countries are related to too much exposure. So the causes are different, but the end result is the same. It's inflammation of the gut. Yeah. Okay. Inflammation of the gut in the US shows up as immune diseases like ulcerative colitis or Crohn's disease, and in poor countries it shows up as malnutrition. They just cannot absorb food. And we now know that, for example, poor gut microbiome during pregnancy results in a baby that is what we call intrauterine growth retarded or small born low birth weight. And now we are figuring out what collections of probiotics you can give to actually really get rid of that inflammation. Okay, so it's huge and it looks real. Like I'm seeing the data. Okay. Now, the other place that this will be very helpful is in vaginal health. So a lot of gynecological disorders right now have no treatment, like bacterial vaginosis. Bacterial vaginosis has no treatment. Women keep getting recurrent infection, and they keep having to take antibiotics, and it comes back. And now we know that actually a cocktail of a few probiotics can take care of it. And if you have this bacterial vaginosis, you're also much more likely to get HIV because you're inflamed. So other bugs can get in, so HIV, other STIs and things. So we think that by being able to give a probiotic that creates a healthy microbiome in different parts of the body, you actually get rid of a lot of other diseases. So I think these are two very real innovations that are going to be helping women everywhere around the world.
And what's you mentioned about the prenatal vitamins, it's $2.50, can give prenatal vitamins throughout the entire pregnancy. What about the cost structure for something like that?
Yeah, so that's a great question, Serena. So one of the things that the Gates Foundation, that is our job, is to see like how can you make low-cost innovation possible. So in fact, one of the people who's working on this gut health issue, I just met them in Boston earlier this week, and I was saying the most important thing to us, apart from getting this done quickly, is to bring the cost down, right? To bring the cost down, so it is a $2 thing. Yeah. Like so, the whole course should be $2, because otherwise it's not accessible, right? It's not accessible around the world. So my favorite thing is it should be less than $1, but not everything can be less than $1.
The dollar store, right? The dollar store exactly. For healthcare.
Yeah. Yes, exactly. Yes. Right. Yeah.
Midwives and frontline workers are, the backbone of women's health, and especially worldwide. But they remain some of the most undersupported. And one of the hopes of this Boston moment, I think, was to mobilize new funding and energy around that. What will it truly take, not just in dollars, but in mindset, in will, in models, to finally value, invest in, and scale the kind of community-based care women everywhere deserve?
Yeah, so I think that I come back to are women in the right roles to be leading this change? And when I talk to midwives in, let's say, Nigeria, they talk about safety. They talk about inadequate pay. So they talk about lack of equipment. So one of the programs that we've been proud to fund from the foundation is called Women Lift Health. Okay, and what this program does is It takes mid-career women from different sectors of the healthcare system and tries to see how do we equip these women to be better advocates for their own area of work. So the idea is that people will solve their own problems if they have the right skills, right? And so the idea is to have like 5,000 or 6,000 women around the world who are in these sort of leadership roles who can advocate for better health systems. So this program is also in North America. In fact, the Women Lift Health also helps women in North America who want to get leadership training for a year, mentored training, to equip them to be better advocates for their areas of work.
That's amazing. We know that, obviously midwives are, providing primary prenatal care for women around the world, and still in this country as well, midwives still do a fraction of the births that happen here in the United States, and that number needs to change as well.
I completely agree. So, so the best outcomes for moms are if midwives are leading maternal care. Okay, it's as simple as that. And there are countries that get that right. They're Scandinavian countries.
The Scandinavian countries.
Yes. I mean, if you look at Scandinavia, they have the best maternal outcomes, and because they have midwifery-led models of care.
Good
so I believe in midwives.
Thank you. Thank you. Yeah. We are, sometimes when we're, we've talked a lot of stories, and we got the opportunity to talk yesterday a little bit about some of the incredible work that you've done around the world. And sometimes it just takes kind of that one moment to remind us of why this work matters. I have those stories in my head of things that I've done over my career, and like, this is why I get out of bed every day. This is why I show up to work every day. Is there a story in your vast experience that's really stayed with you? Is it one that shows, kind of how far we've come and how far we still need to go?
Yeah, so there are so many. Okay,
Yeah.
So maybe I can do two. I recently had a colleague at the Gates Foundation who developed, after many years of trying, she became pregnant, and she developed preeclampsia in her pregnancy. Now, preeclampsia is hypertension during pregnancy, and it currently has no treatment. So the only treatment, the only treatment that exists is you have to deliver the mom. Yeah, so otherwise the baby's life is at risk and the mom's life is also at risk. So she was really struggling, and eventually, we all tried to help her. She got the best care possible. She had to deliver 2.5 months before a premature baby. The baby got excellent care, and both mom and baby are doing fine. I have her permission to talk about her baby. Her name is Mahika, Dewdrop. It made me think of all of those women that I have in my career and practice in Pakistan as a pediatrician that I haven't been able to help because there has been no treatment, there has been no support for premature babies. So if you deliver the baby, deliver the mom, the baby dies, right? And you see, and sort of the look on the family's face and the mom's face, like, you can't do anything for me. There's nothing that you can do to treat this.
Yeah.
That happens in the US as well.
Yes.
Right. Because there is no treatment, and there are low-income women in the US who don't get, these are some of the reasons why mortality in African-American populations is so much higher, because it's not diagnosed, preeclampsia is not diagnosed, and both mom and baby suffer. The other one I would mention is because Junaid is here and Sophia is here, which is the story about supply chain, right? So we don't think of supply chain as a medical issue, right? But it is a huge medical issue for the last mile. It is what results, not getting your supply chain right, is what results in the kind of story that I was telling you earlier, that a mom could walk for 20 kilometers and not have the drug or the equipment that she needs for her care because somebody messed up the supply chain. I would use another word, messed up the supply chain. Okay, right. So how do we bring the best minds to think about supply chain for poor countries is something that I am really going to pick Junaid's brain on, and we've connected him up with many companies who have to figure this out, like UNICEF. He was talking about how do we do better for people around the world.
And I think that brings us to a point of, where we talk about health outcomes, or we're talking specifically about, maternal health outcomes, or, maternal mortality or infant mortality, I think so often people think, well, this is healthcare's problems to solve, right? And it's not. We do our part, right? But I always like to, we have an incredible group of leaders throughout the region here from all different industries and walks of life. And, I think it's an important discussion to say, what can you do in your space, right? What is it that you can do in your space? If you're an employer, what's your paid leave policy, right? How do you provide opportunities for economic growth and advancement for your workers, your lowest paid workers in there? Those are things that I think we need to think about or encourage other, industries to think about, wouldn't you say?
100%, yep. In fact, Cleveland has such a rich tradition of people stepping up and helping. And I asked in my, when Dan was giving me this book, I said, well, who are you, who would you say are top of mind for you for moms and babies? And he gave me a list, so I want to read that out. It's not exhaustive. I'm sure there are many other people. So Cleveland Foundation, Gund Foundation, Mount Sinai Foundation, St. Luke's Foundation, JFF, Junaid Family Foundation, are doing incredible work. And then the people who are the recipients who are just making an incredible difference in their communities. A few of them here for relevant for moms and babies. Birthing Beautiful Communities, Jasmine Long.
Yep.
First Year Cleveland, which is a coalition that focuses on the baby's first year of life, the infant mortality. And then the Greater Cleveland Food Bank that I got a wonderful conversation. Who are doing incredible work, and I got to see some of I didn't get to visit, I would have loved to visit, but I got to hear from Junaid about what they're doing with you, and so incredible work that is looking at, it just connects up, how we are thinking about nutrition and pregnancy for vulnerable populations globally and locally here in Cleveland, right? And I'm super looking forward to looking at the results of that study that you're doing. Thank you.
And and we talk about, of course, my love for midwives as a midwife, and your love for midwives. Really proud to say that there's so many midwives here in Cleveland, right? All three major healthcare systems: Cleveland Clinic, University Hospitals, Metro Health is the newest one to have opened a midwifery service. We have midwives in private practice throughout the region, our FQHCs. So anyone who wants a midwife should have access to a midwife. And so really grateful for the partnership of other healthcare organizations here in town who are lifting up that narrative and making that available for women here in this community.
Wonderful, great.
So anything else you want us to know about the wonderful work of the Gates Foundation and some of the initiatives that you're focused on? We've talked a lot about maternal health.
Yeah.
I'm wondering if there's other things in terms of gynecologic care or other areas of interest or focus that you're looking at.
So I would spend a couple of minutes talking about contraception. Okay. So, there are 200 million women around the world who want contraception and don't have access to it. Okay. Then there are a lot of women who want contraception, but there is no option that works for them because of their needs and preferences. So it's actually a global problem. And so one of the things that's in this $2.5 billion announcement is looking at newer options for contraception. And I'll mention a few of them, so just so that you understand the breadth of the possibilities. One is, how about if there was a patch that you could just put on for 2 minutes and take it off, and it lasts for 6 months? You only put it on for 2 minutes, the drug gets in, but it's in a depot form that can last for 6 months, okay? So totally system independent, it could be over the counter. What if we had that? So we're trying that, okay? What if we had non-hormonal contraceptive options that you could take by mouth, okay? Because currently all of the stuff that you take by mouth is all hormonal. And it works wonderfully for many, many women, and they have been able to plan their lives. I love the slogan, made possible by family planning. All of us are sitting here today and having a good life because it was made possible by family planning. Okay. So we are doing that. That work is actually, I have learned so much from sort of funding that work because I had no idea how much knowledge about women's biology is just lacking. So some of the, like the questions, for example, if you take a drug by mouth, how much of it actually gets into the uterus? We don't know the answer to this. We don't know, right? So we're actually having to start there, right? Understanding the blood uterine barrier, right, for drugs. Because sometimes you might want a drug to pass through, and other times you might not want a drug to pass through, depending on what your clinical indication is. So a lot of this work will be very basic science, reproductive biology, trying to understand how drugs work in women's bodies. So that's two, and then the third contraceptive option, which is primarily focused on developing countries, and many women will know this option, Mirena, the hormonal IUD, not available in developing countries, right? And it's really the best treatment also for heavy menstrual bleeding. Yeah. So we don't have that in developing countries, it's too expensive. So we're trying hard to make a lower cost option for a hormonal IUD for women in developing countries.
That's amazing.
So this is also a contraception problem, but also a heavy menstrual bleeding problem.
Yeah. No.
We don't even know how many women have heavy menstrual bleeding because we don't have a definition for it. Okay?
True.
So
yeah.
those basic things.
And we don't talk about it, right? Because we think
it's
like we need to start talking about these things more, about the things that women have to deal with, and how do we, and what is the innovation that could be placed in this space to make their lives better, right?
Couldn't agree more.
So we're about to begin the audience Q&A. For those just joining in via our live stream or radio audience, I'm Selena Kunyanan, Chief Health Impact Officer at University Hospitals and moderator for today's conversation. Joining me on stage is Dr. Anita Zaidi, President of the Gender Equality Division at the Gates Foundation. We are discussing the Foundation's efforts to improve outcomes for women and children across the globe. We welcome questions from everyone, City Club members, guests, and those joining via our live stream at cityclub.org or live radio broadcast at 89.7 WKSU, IdeaStream Public Media. If you'd like to text a question for Dr. Zaidi, please text it to 330-541-5794. That's 330-541-5794, and City Club staff will try to work it into the program. A reminder to keep your questions short, to the point, and actually question so we can get to as many questions as possible. And we'll have the first question, please.
First of all, congratulations to the City of Cleveland, and in particular City Club. We're honored to have the Gates Foundation here. The good that you do is immeasurable. Thank you. And I had a question as a fellow pediatrician. I know as a fellow pediatrician, we've all been in situations, well, this really goes to Paul Starr's work on the power equation. And things don't happen unless the power equation goes your way. So what advice can you deliver to Cleveland that would be relevant from your world experience when doctors, other healthcare professionals, midwives, and others find themselves in confrontation with other powers that stand in the way of advancing health, whether that be government or corporations or even medical centers?
Yeah, so it's very relevant to the conversation around vaccines as well right now. And vaccines are the most cost-effective intervention in public health that exists today. And I am very worried that in the United States, you will see a lot of regression. And you will have many big measles outbreaks, you'll have pertussis outbreaks. Lots of children will die, not as many as in developing countries because it's a global world right now, and a lot of what happens in the US then starts happening in the rest of the world. The US has historically been a leader in fighting diseases, poverty, and malnutrition around the world. I think that's a really, really important role, and we have to fight to preserve that role.
Good afternoon. This is such an important program, and I'm so glad it's happening. It's pretty common knowledge, where a lot of people know, that there is a serious lack of trust between the African American community and doctors. And I'm speaking generally, of course. But so, because of the Tuskegee experiment, and I've been told by doctors that doctors are taught that African Americans can experience more pain than other races. So my question is, how do you deal with that lack of trust? What is done to try to encourage African American women to feel comfortable in the work that you're doing?
Thank you. That's a great question. I will answer it from a developing country perspective, and then Selena, I will, because I see these issues all over the world, but the solution is the same. Okay, and then you should talk about the U.S. and the Cleveland experience. So what happens is why does distrust develop? It's historical and based in inequities and what was done to marginalized populations, and so in our work, what we have found is when you have so for example, in these very vulnerable communities that I've done a lot of my research in, often we would refer a woman to a hospital if we thought that really this is a hospital delivery, you should not be delivering at home with a birth attendant and whatever, and they wouldn't listen. Okay, they said, because they didn't trust the hospital system. We realized that if we paired her with a woman from the community who could go with her, so the doula concept, right? So that there was somebody to advocate for her, who knew the hospital, who knew how things work. It just tremendously increased community trust to have that her person there with her, right? Her person who knew her community, who knew her, and who knew the hospital. I think this is a universal principle. When there is lack of trust, how do you bridge that trust? In the US, this worked very well in COVID. Right, because we learned that there was a lot of distrust among African American communities for getting COVID vaccine. It was solved by engaging community, right, and community leaders. From the Cleveland side.
Yeah, I think it's still the same, right? How do we listen to women? How do we center their voices? How do we uplift what their needs are? And I think we're and partnership, right? Healthcare organizations, yes. In general, right? Not lack of trust for communities of color. How do we make sure that there's leaders within the organization that are listening, that are forming partnerships with outside organizations, community-based organizations? My hat's off to my friend Jasmine Long in the back and Birthing Beautiful Communities for their incredible partnership and how they partner with all healthcare systems across this region and FQHCs to make sure they're building strong, healthy relationships with healthcare partners and community members to ensure that the voices of women are heard. To your earlier point about women in leadership, right? Are there women of color in leadership in organizations? How do we elevate their voices in that manner? That's where we have a lot of work to do, even just in terms of getting more professions that represent the people of the community. In the United States, maybe 15,000 midwives across the country, less than 10% of those are Black, less than 2% of those are Asian. Same thing in healthcare in general, too. Purposeful investment in encouraging people of communities to get them into healthcare careers. It's a lot of the work that I do at university hospitals as well with our youth pipeline programs and exposing kids from communities that might not otherwise have those opportunities, be exposed to healthcare opportunities in the system, I think is really, really important. It's a long game to get those things done, but there's always things that we can do and every organization needs to be doing. So, next question.
Good afternoon. Tony Richardson, President, George Gunn Foundation here in Cleveland. I think this past May, Mark, Bill, your Board of Trustees announced that you are all going to sunset in 20 years. So in 2045, the plan is to accelerate or deploy $200 billion across your portfolio and grant making globally. And I'm just curious to get a sense, how are you thinking about your particular portfolio in a way that allows you to deploy those resources and strategically, responsibly, with care, and in a way that protects your existing investments so that when you all leave in 2045, there's some self-determination, some infrastructure for the various communities and peoples that you've supported over the last.
It's a fantastic question. Yeah. So let me repeat it for people who might not know what you just said. So Bill Gates announced earlier this year in May that the foundation will sunset in 2045. So he will give his entire wealth, 99% of his wealth, $200 billion, to the foundation to be spent over the next 20 years, and then we will close our doors in 2045. His motivations are that he feels that he wants to solve the problems of today, right? He's not interested in sending people to Mars.
Thank you.
And so solving the problems of today means that you spend the money today. Okay, this puts a certain extra responsibility on us to bring a sense of urgency to our work. And that was part of what motivated me to work on this 5-year thing, like what can we do in 5 years for women's health R&D to really sort of accelerate the pipeline to get these 40 things out that I think could be real. It also behooves us to think about who carries the work forward when we are not there, right? And that thinking is very active right now, actively happening at the foundation right now. How do we leave a world that is much better than it is today, and who takes the work forward, right? And the hope is also that many other people will join in the effort. We are in a crisis situation right now in the world, in global health, in many other areas, and so we are hoping that many other people step up, many other philanthropists step up and say, you know, we want to solve the problems of today, right? And also give their wealth. There is, some of you may know about this Giving Pledge, which is a effort that Bill, Melinda, and Warren Buffett started to get very high net worth individuals to commit that they will give 50% of their wealth away during their lifetime, or soon, or upon their death. And so getting those Giving Pledge members to act on that, as well as getting new people to sign up, is very important right now.
Good afternoon. Jasmine Longworth, Beautiful Communities. In a study by the Commonwealth Fund, it showed that the U.S., amongst most developed countries, we were 11th with respect to paid leave, time off for families. Anita, my question is, as you all look to diversify and think about economic mobility, how is or has or will the foundation seek to explore economic mobility through things such as paid leave?
That's a great question too. So I'll say two things in response to that. So we know when we look at, okay, what affects women's careers and income generating ability, in every conversation we have anywhere in the world, having access to affordable childcare, it comes up very, very flexible work schedule and affordable childcare. From the foundation, what we have done, so the foundation doesn't work on these issues directly on care issues in the United States. I'll come back to how the foundation works in the United States on these issues, but globally, we have supported through the World Bank a trust fund for countries that are interested in improving affordable childcare in their countries. And when we set up that trust fund, it's about $100 million. It has been so oversubscribed that the money ran out much quicker than we thought, because so many countries are interested in figuring this out, because affordable childcare is actually essential infrastructure. It's as important as telecoms and roads and things, and it's also an employment and income generator. The particular issue of the US, which does not, is one of the few industrialized countries without federally mandated paid leave during pregnancy. This is a topic that is very dear to Melinda French Gates, and now she's no longer part of the foundation. She co-founded Pivotal Ventures, and that's a very big issue that she's focused on from Pivotal Ventures. And so within the Gates ecosystem, it's an important topic that is being advocated for and funded.
What about paid leave here in the United States? What do you think needs to happen here?
I think policy needs to change.
Yeah.
I mean, it's without that. I mean, people are talking about declining populations, but there's a very big reason for decline. It's very hard to. Childcare is very hard. I mean, in fact, I even give this example. It's very personal. I have two children. Both of them were born in the U.S., but I waited 7 years to have my second child because there was just no way I could take care. I could afford childcare for 2 kids, right?
Yeah.
So, and my second child was born 3 months before I left for Pakistan. I timed it perfectly so that I could get childcare in Pakistan. And it's much harder to bring up kids in the U.S. because of the childcare issue than it is in so many other countries in the world.
Yeah.
Okay.
Thank you, Dr. Zaidi, for that wonderful overview of Gates Foundation work for maternal fetal health. And my name is Marina Magre. I work at University Hospitals. You alluded to this that gender-sensitive research is something that's lacking, and lately a lot of funding for gender-sensitive research has been cut back. Like, let me give you an example. Like, the best example that women have high pain tolerances that they give birth to babies, which is the most
Sorry, can you
painful.
repeat that part? I missed it, sorry.
Women having the high pain tolerance, giving birth to babies, that's the best example of that. But a lot of research shows that they have less pain thresholds, and a lot of gender-sensitive research is lacking. What's Gates Foundation, what other areas are they focusing on for gender-sensitive research?
Yeah, so that's a very big part of what we're looking at is how do you center women's biology into research, which has been neglected so far, including pain during IUD insertion. For example, we think that there are innovative tools that can be much less painful, but they just have not been researched. So that's what I meant by when I said, just like the basic research and products that are keeping women's needs in mind and talk to women. So a lot of the contraceptive research, for example, we're doing a lot of user insight work. We're saying, like, what is it that you want? What is it that will work for you? What is it that you hate, right? To inform product design. And now because of AI, you can actually do it very quickly. So like you can just because they can chat with the bot, right? And say, I mean, you can ask this question, you get the response. We have a project that actually is in Pakistan as well, but it's also in many different countries around the world, which is called A Day in the Life Of. So it follows women for like a week and gets responses from them about their life, whether it's about their menstrual products or their contraceptive needs or their pregnancy or their diet, and gets like tons of information that can be very quickly synthesized into like, okay, what is lacking that needs to be addressed. So we are funding a lot of work like that.
Hi, my name's Kent Smith. I'm a state senator for Ohio. In January 2023, University Hospital hosted an issue briefing for the Aga County delegation that talked about, among other things, the research on the destructive nature of utility shutoffs in the first year of life that led us to introduce legislation to try to have the most comprehensive utility disconnection policy in the country. Now, that didn't become law, but I wanted to thank University Hospital for providing that forum. I do believe the relationship with the Aga County delegation has been harmed by the firing of Dr. Fouts-Fowler and Dr. Bean. But what I'd like to ask you, Dr. Zaidi, is I've heard you talk about prenatal vitamins. I've heard you just talk about childcare. But can you think of other solutions from a state policy perspective that could be used to advance maternal and child health care, or would those be two things that you think we could take back to the Capitol? Thank you.
No, that's a great question, and I'm also going to ask you to come in on that as well, because your perspective for Ohio would be very important. I think listening to women, that's the simplest thing. listening to women, what is it that they want and need, what works for them, and then introduce that into policy. So without consultation with the women from communities, from different communities, from underrepresented communities, you're not going to have great policy for moms and babies. Now, Ohio is one of the states that has a higher maternal and child mortality rate than many other states. Often this is because there aren't avenues for women to seek or get appropriate care, right? There are states that have had when they recognize this, for example, that there are racial disparities, racial inequities in access to care, and they addressed it. They made huge progress, and so that would be my sort of where I would start looking. and seeing like how can we do better. I think the program that we just heard about from or I was alluding to from the Greater Cleveland Food Bank, where they're trying to see how do we improve the diets of low-income women, right? So of low-income pregnant women could provide results that are directly relevant to state policy.
I think just, looking at the minimum wage, what are we paying our workers? How are we providing them, again, upward mobility so that they can afford the everyday things that they need? Paid leave is huge. I think those are the things that we think we'd like to see in the state that can make things better for all women here in the state of Ohio.
Thank you, Dr. Anita Zaidi and Selena Kunainen, for joining us at the City Club today. Forums like this one are made possible thanks to generous support from individuals like all of you, and including many of you. You can learn more about how to become a guardian of free speech at cityclub.org. Our forum today was presented in partnership with the Junaid Family Foundation. We thank you so much for your engagement. We would also like to welcome guests at tables hosted by the Center for Community Solutions, Collaborate Cleveland, First Year Cleveland, G2G Consulting, the Junaid Family Foundation, Newbridge, and University Hospitals. Thank you so much for being a part of this today. Once again, Dr. Zaidi, Selena, thank you so much. Our forum is adjourned. Have a great weekend.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
The ideas expressed in City Club forums are those of the speakers and not of the City Club of Cleveland, IdeaStream Public Media, or their sponsors. Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.